There it is, eliminate T3. En route to RVH.
This wasn't staged for the cameras. Northern Ireland's air ambulance is responding to a live call. The crew's mission, as always, is to preserve life. Minutes later, they're putting this training into practice, intubating a patient.
OK, folks, so just to recap of where we are, obviously we've extricated this patient. He's fallen 20 feet.
Every day begins with this kind of exercise, and PPE has brought unique challenges.
Well, one of the biggest challenges is communication. You know, I'm talking to you tonight with normal tone and voice, but we had to raise that up, you know, whenever we're speaking. And particularly in an aircraft, we're wearing our helmets, we're wearing these masks. So I'm talking to the pilot, talking to the doctor, and sometimes you've got to speak louder and are really reliant upon effective communication.
Hems call in Belfast. Stand by for details.
It isn't long before they're doing it for real. Ambulance headquarters in Belfast is requesting the helicopter emergency medical service. They quickly deploy from their base, formerly the site of Northern Ireland's notorious Maze prison. From this place long associated with death, they are saving life. But the pandemic poses a real threat in the confined space of an aircraft. Within 5 minutes of the 999 call, this crew can be on board and ready for departure. But it doesn't matter what kind of incident they're responding to, they now have to assume that every patient is COVID positive. COVID has increased the number of incidents. They're keen to ease the pressure on their land colleagues. Rooftop landings at the Royal Victoria Hospital have become routine. But increased isolation during lockdown has changed the nature of calls. They're dealing with an upsurge in life-threatening injuries caused by attempted suicide.
A variety of traumatic injuries that are as a result of mental health and the stresses of society dealing with the COVID pandemic. We are able to bring interventions, airway secure, ongoing CPR, for prolonged duress. And that's certainly probably one of the stark things I've noticed, whilst there's maybe been a dip in some of the road traffic collisions that we attend.
They're not the front line in the fight against COVID, they're a critical back line. Trauma doesn't stop during a pandemic. Tomorrow will bring different challenges for Northern Ireland's air ambulance team. David Blevins, Sky News, at the Maze.